Okay, my name is ASIIMWE ENOCK. I'm doing a PhD in education with Texas American University. My article is Contemporary Early Childhood Care and Education Programs, a Key to National Development, a Case of Botswana. The article entitled Contemporary Early Childhood Care and Education Programs, a Key to National Development, reveals in its background that globally there is an increase in access to education at all levels. On the contrary, the quality, completion, and transition rates on decline, and Botswana is not exceptional. Early childhood care and education is considered as a process, stage, or set of programs. As a process, it's through which young children grow and thrive physically, mentally, emotionally, socially, and morally. The process begins at conception and extends 8 years. Despite the benefits of the ECCE programs, 17% of children in Botswana have access to such programs. That's UNICEF 2007. In December 2014, the Transformative Conference convened by UNICEF and Ministry of Education and Skills Department explored models of early childhood development that best suit Botswana. A concern was expressed that only 22% of Botswana children access early childhood education programs. It was posited that early childhood learning fertilizes the ground to inspire future constructive learning. The paper suggests that it is crucial for the government to provide grants centers that are owned and run by NGOs, churches, and local communities. As mentioned elsewhere in the paper, such facilities operate under severe financial constraints which affect the quality they provide. The government should intensely monitor and supervise all existing ECCE structures to ensure that they meet standards that are outlined in the ECCE Policy 2001, which responsibility lies with various stakeholders. In a nutshell, early childhood care and education programs tap into critical and sensitive windows of opportunity and periods of brain development. To be competitive in the world marketplace now and in the future, nations must develop, adapt, and support local, regional, and national policies that provide early childhood care and education programs. Countries that have recognized the importance of investing in early childhood and care education to improve the competence, health, and well-being of their populations include Cuba, the Scandinavian countries, and several Asian countries such as Japan, Singapore, and South Korea. Statement of the problem. Globally, there is an increase in access to education to all levels. On the contrary, the quality, completion, and transition rates on decline, and Botswana is not exceptional. These trends are closely associated with poor quality of early childhood care and education programs available to the children. Early childhood care and education, a critical aspect, is averting the problem, has long been neglected by the communities and the government as an unnecessary cost. This poses a challenge on the quality of children entering primary school and subsequently undermines their performance at all levels of education and in the world of work. In fact, the situation is partly aggravated by government's failure to partake or at least partly sponsor education at this level. In essence, preschool education in Botswana has always been and still remains a privilege to children of the elite, as required fees are immensely varied and exorbitant for an ordinary man. Bose 2008. Recent studies by Bose 2008-2010 observed an acute shortage of qualified and trained personnel, particularly in public centers, and this problem has exacerbated by the absence of a prescribed curriculum. However, a lot of changes have occurred since then, and the sector has witnessed phenomenal growth. For example, according to the Gaborone Day Care Directorate 2001 records, Gaborone alone had 81 registered early childhood care and education programs with ownership spread across different divides. See figure below. In this figure, it indicates the total of the centers in the Gaborone city, whereby the private 64, churches own 4 centers, NGOs 6 centers, community 2 centers, and the institution 1 center. Methodology. The paper has been developed from a case study of one tertiary institution in Botswana. Data was collected through focal group discussions with early childhood education students, in-depth interviews with teaching staff in the early childhood education department, finance department, administrative staff, and sampled early childhood care and education centers in Gaborone City, and document analysis of conference papers and reports on early childhood care and education. The responses have been thematically arranged and described from early childhood care and education students and early childhood care and education center managers' perspectives, discussed and backed up with information from in-depth interviews and document analysis. Results and discussions. There is mushrooming of preschool centers which have gone by various names such as daycare centers, nursery schools, pre-primary units, reception schools, and kindergarten classes. As the demand for early childhood and care education increases, issues that need attention has become complex and multifaceted. Therefore, this necessitated the formulation of the Early Childhood Care and Education Policy of 2001. In December 2014, senior government officials, politicians, private sector, media, civil society, and experts of early childhood development gathered in Gaborone to dialogue on the importance of assuring that each and every child is afforded the right conditions and environment to reach his or her full potential. The Transformative Conference, convened by UNICEF and Ministry of Education and Skills Development, explored models of early childhood development, that is ECD, that best suit Botswana. The former Vice President of the Republic of Botswana, Dr. Ponsheho Kadilirwi, called on delegates to ensure that early childhood development is put at the center of the national agenda. A concern was expressed that only 22% of Botswana children access early childhood programs, adding that the situation is counterproductive because children who do not access early childhood care and education miss out on the benefits of the programs. It was posited that early childhood learning fertilizes the ground to inspire future constructive learning. Early childhood programs help to ensure that children receive health care and nutrition that enhances children's health and encourage young children to explore the environment. They also facilitate social interactions that promote children's mental development. Children attending early childhood care and education programs are less likely to drop out of school than those not participating in these programs. Research shows that attendance in early childhood care and education programs matches with increased enrollment, children's readiness for school, and retention in primary and secondary school, improved behavior, and better academic performance. That's according to Myers 1995. References. Here is a list of some few references. Baon, 2004 Early Childhood and Education in Africa, the Case of Botswana, Journal of Early Childhood Research. Then next is Bosa, K 2008, Gaps and Remedies for Early Childhood Care and Education Programs in Botswana, that's Educational Research and Reviews. Then Bosa Still K 2010, Issue of Holistic Development of Young Children in Early Childhood Education Centers in Botswana, Literacy Information and Computer Education Journal. And another one is Daycare, Gaborone Daycare Directory 2011, Gaborone, UNICEF 2008, social protection in East and Southern Africa, a framework and a strategy for UNICEF. Conclusion. This article concludes that attendance in early childhood care and education programs matches with increased enrollment, the children's readiness for school and retention in primary and secondary school, improved behavior and better academic performance, Mars 1995. The findings show that there has been a phenomenal increase in the number of early childhood centers, but with fragmented structures. Therefore, it is crucial for the government to provide grants centers that are owned and run by NGOs, churches, and local communities, since such facilities operate under severe financial constraints which affect the quality they provide. The government should intensely monitor and supervise all existing early childhood care and education structures to ensure that they meet standards that are outlined in the Early Childhood Care and Education Policy of 2001, which responsibility lies with various stakeholders in charge. The study also revealed that improving human development in the early years is the surest way out of poverty because it has a very high economic rate of return. Early childhood care and education is the first step in this process, as reflected in the priorities that emerged from the DECA EFA meeting.
ENOCK,
UNESCO 2000.
your time is up. Your time is up.